Hi, and welcome to another live from Exhale. If you're new to this live stream, this is a company that provides lung rehab online at www.joinexhale.com. I'm the founder and CEO, Wendy Lawson, and we love to feature other people on our program, bring you helpful tips and hints and products that might bring value to your life and make it a little bit easier to navigate lung disease. So I'm so excited today to have Melissa with us. Melissa is the founder of Heartfield Medical, and she invented something for oxygen users. And those are, it's a little cover that's called O2FRESH, and it's placed right on the prongs of your nasal cannula. It keeps it from hitting the ground and getting bacteria and virus on it, and it keeps it fresh. So welcome, Melissa, and we're going to ask a few questions of Melissa and hear her story. She has an amazing story. So welcome, Melissa.
Hi, how are you?
I'm great. Thank you so much for joining us today. I'm really happy to have you on. And I love featuring the O2FRESH. I love
Thank
other
you.
founders that are women, so congratulations.
Thank you.
And I thought we would start out with a little bit about your story with lung disease.
Ah, good question. I became sick when I was 3 years old. I had a viral influenza that pretty much destroyed my lungs. And I was in the Children's Hospital in Pittsburgh from fall through about Easter. And at that point, the doctors told my mother to take me home because they didn't know what was wrong. And obviously, I was stable. And if I didn't die, bring me back and they'd figure some more things out. So, so can you imagine being a mom and
No.
being told that? That is just awful. So, I never could breathe. I would always had more pneumonias and colds and pleurisy that did more and more damage. And in 2016, I ended up on oxygen full time. Uh, Prior to that, I had been on oxygen when I was pregnant to protect the baby, who is now 5'11". But yeah, that's another story.
Well, that is, the start of your story. A lot of times people think COPD, that it was only caused by smoking long term. And there's so much more to lung disease. There's so many more avenues that you can get lung disease, lung cancer, asthma, bronchiectasis, NTM, pulmonary hypertension. I mean, the list goes on and on and
Yes,
on.
yes,
And
yes,
it's every one of those categories has the potential for using oxygen, because as the
yes.
lung disease progresses, you may not be able to have that oxygen uptake into your blood, and that's a real problem.
Right. And I actually have developed bronchiectasis as well. Um, so that is fun. And I'm being monitored for pulmonary hypertension, but I have not developed it yet. So that's
Excellent.
excellent.
Yeah, fantastic. Well, tell us, I know that you have participated in pulmonary rehab, and you are a big proponent of pulmonary rehab because your experience in the
Yes.
past with going. Can you tell us a little bit? Because for those out
Mhm.
there that have never heard of lung rehab or they're scared of going, can you tell us your experience and
Right.
kind of how it
Yeah.
helped you?
Well, first of all, I want to back up just a hair to the period before pulmonary rehabilitation, which is really important to talk about because I think we all fight it, right? Or we're in a little bit of denial that, I don't feel that bad. I can still do things. We push ourselves and we push ourselves. And then you finally get to the point where you can't do anything. You end up on oxygen or you end up, you know, sitting too much during the day. It became really hard to just walk through Walmart. And that's not a life, you know.
Mm-hmm.
You hear it time and time again. The more you move, the more you can do. And that is just so, so true for me. By the time I went on oxygen, I could not put the laundry from the washer to the dryer without my oxygen going down to like 60. I
Wow.
was a mess, right? So when the doctor suggested pulmonary rehabilitation, I really didn't question it because I tend to do what they suggest. So first of all, I want to point out how incredibly successful it was because it's such a supportive atmosphere. And I think that's what people get also through your program. You have these people who understand what you're going through.
Mm-hmm.
And so and you have that one-on-one time with a medical professional that you don't get anywhere else. You get the support, the encouragement. They lift you up. You know, today I couldn't do the treadmill. That's okay. Come back tomorrow. And they call you and make sure you come back. And it's like, you just need that little push. And, you know, I've done so well with it that last year, my family and I did the American Lung Association Fight for Air climb, where I climbed up and down 1,500 steps to
Oh
raise
my
money for the American
goodness.
Lung Foundation. Yeah, that's on my
That's
website.
so exciting. And
Yeah,
Exhale has a team that's going to be climbing in March in Oklahoma. So we definitely think that's an awesome thing to raise money for.
right. And
But
it's nice to have a goal too. So whether you're in pulmonary rehabilitation, like I need to start training now for this event because I haven't been doing steps or squats, right? But whether you have a goal to walk more easily around Walmart, or I want to be able to play with my grandchildren, I want to go out to the mailbox or garden. It's good to have that motivation to keep yourself on track, which is another great thing with the pulmonary rehabilitation because now you're working towards your goals. It's not just, I'm here, I can't breathe. It changes the conversation in your mind. Do you find that helps with patients?
yeah, I think one of the really important things of pulmonary rehab is having, like you said, something to look forward to. And I know that I have to either go to this in person program or
Yeah.
that I have to log on today, like in ours online.
Mm-hmm.
And I know I have things to do that are going to strengthen me, right? And
Right.
tomorrow I've got a little bit more, and tomorrow I got the next day I have a little bit more. And that really helps, I think, keep us on track. Because I know
Yes.
for myself, I can have all of these ideas about what I'm going to do and what I'm going to accomplish physically, but unless I have those little daily goals that are stepping me to that bigger goal, I often don't make it.
And you know, an illness like this can be isolating.
Mm-hmm.
So to have that support, whether you're an extrovert and now you can't get out of the house and do the things you wanted to do, or you're an introvert and you really do need people to reach out to you, your program is great because you have that constant communication with people, don't you?
Yes, absolutely. Our staff, they get, text messages from us to encourage them and say, way to go, you've logged on 2 or 3 days in a row and we're watching and we know that you're doing good things. And then our staff calls also and says, can we help you with anything? Have you been to an appointment lately and you don't understand what they said to you? Or do you have questions that maybe you were not able to ask? Or do
Right.
you have questions about the lessons that you learned in our program? So that's really helpful.
Yeah. And what's really helpful too is you can see the progression. Like the respiratory therapist in your program or an on-site program, they're going to meet you where you are.
Mm-hmm.
If you can only walk, 100 feet, great, we'll start with that. And tomorrow we'll go a little further or we'll add on another thing. Now, I know with pulmonary rehabilitation on site, you work with different machines and you rotate among the machines, but with yours, they give different things you can do at home.
That's right. Yeah,
Right.
and we, our physical therapist and yoga instructor and respiratory therapist and pulmonologist have all worked really hard together to make sure that wherever you are in your assessment, we meet you there, right? That your classes are programmed just for you. They aren't the same classes that everybody else has taken. They are meeting you where you are. You give us feedback, and then if it's too hard, we switch it up for the next day, right?
Right.
And you said something earlier about kind of it being a silent disease sometimes, and I have experience with that, and I know that people often, say it doesn't look like you're sick, right?
Yes.
I have severe asthma. As a child, I was in the hospital 1 to 2 times a year, every year, took a lot of medicines. There were periods of time that I was so sick they were not sure I was going to live. And so I understand what it means to not be able to breathe. But looking at me, I try to stay active. I try to do the things. I don't let that disease process define me. But it definitely has, my passion is behind lung health because I have suffered as a lung disease person. And so that often you don't see that when you look at me.
Right.
And that's how a lot of lung disease is. Lung cancer, asthma, COPD, bronchiectasis. You can be any age and get these things. And it doesn't look from the outside like you're suffering, but inside it is. And so lung rehab really helps surround you with people that understand, can meet you where you are, and then help guide you to meet those goals that you have for yourself.
Right. And by the time you go on oxygen or get to rehab, you really are at some of the worst points in your life. The important message is that, and I don't mean to overstate this, but there is hope, right? It's an empirical fact that there are people who have been where you are and have been able to improve. Am I running a marathon? No.
Yeah.
Wish I could.
Right.
But I can go out with my friends. Pre-COVID, I was able to fly and be a tourist in places. I haven't been on an airplane in a couple of years because I don't want to get a virus. But I mean, there is hope to be better. I'm not going to say it's a cure because we all know it's not, right? It isn't.
It is not. It is not.
And it's not all Instagram happy, Instagram influencer where you see people with disease going out and doing everything. And no, it's a fresh kind of life. It's a remaking, and it's a process. And pulmonary rehabilitation is a safe place to undergo that process.
Right. Well, I really want to hear a little bit more about O2FRESH.
My
because
baby.
I think it's so amazing that you decided, you know what, here's a problem I have, and I'm going to solve it for everyone. And especially now that, we are hyper alert about viruses and bacteria and how we get infected, which is something that's really important with lung health. So can you tell us a little bit about O2FRESH and how and why you developed this amazing thing?
Wow. Thank you for all those kind words. The best inventions arise out of patient need. And if you didn't live with oxygen and live with it at home or have been in the hospital as often as we have, you wouldn't realize how nasal cannulas are handled or mishandled. I take mine off to eat, for personal grooming, sometimes for a phone call. I always take it off to take the dog out to go to the bathroom. But I got really worried about what was going on with my nasal cannula prongs when I put them down and they touched the doorknob or the back of a chair, and then I put them back in my nose. Or worst of all, nasal cannulas are always falling on the floor.
Yes.
So yeah, they are, right? And I've talked to a lot of nurses and they're like, we tie them to the beds and then they end up under the patient's butt. Or they toss them over the oxygen flow meter and they hit the hospital wall. And then they're put back in the nose because no one had an economical solution before. So I got noodling around with a 3D printer on the local college campus to come up with a solution. And ta-da! This is my solution.
That's so amazing.
Yeah,
And I was reading a
thank
little bit
you.
about what you have said in the development of that. And you said,
Yeah.
oh, it wasn't always this size, right?
No. I have a whole container full of prototypes.
Oh, wow.
I went through a lot of different shapes and sizes. If you're haven't developed a product before, and I know we've talked about you developing your product and how you go through different iterations of it and you improve over time, which you have done.
Certainly.
So I wanted to get to the right size where it's not too big, but for men, you don't want it to be too small, or arthritic fingers. You don't want it to be too small. Yeah, I added, because if it's in the nose, you get mucus. I added ventilation holes.
Oh, great.
And of course, yeah, and you can see it. It goes in there, no hinge or lid or anything. You don't even have to pause to use it. And the best of all, it just really stays, right?
Yeah.
So it works really well. I keep mine on my nasal cannula, so I have it at all times. And it attaches really well to your portable mobility device.
Fantastic.
Yeah. And we,
I think everyone should have about 5 of those so that you can have one at the bedside and one on your chair and one on your device and maybe one in the car.
most people, my most popular product is a bundle of 2 that I have always discounted. I think it's 10% off. And I did put up a coupon. There'll be a coupon live just after the show for joinexhale.com for another 5% off.
Awesome.
So it is really nice to have 2. They're pocket sized. I have people who are super adopters and they really love them because like they're always falling on the floor.
Yeah.
Always falling on the floor. And it's so incredibly annoying. And this just solves the problem so simply and elegantly. And I've just really enjoyed the process.
Awesome. Well, tell everybody watching where they can get theirs.
Oh, it's heartfeelmedical.com. And it's the O2FRESH nasal cannula cover.
Perfect.
And funny story, if we have a minute.
Oh, yeah, absolutely.
The whole thing has just evolved from a 3D printer because my daughter was a high school robotics student, and they would 3D print at the local college some of the parts they needed for the robot. So that's where I went. And of course, I knew, first of all, if you end up on a college campus and you're my age, everyone looks at you. And then you have the oxygen, which a lot of oxygen users are very conscious about using their oxygen in public. But I knew I couldn't walk across the campus without it.
Right.
So I had to use it. But when I got there, the kids were so helpful. And it took me about 8 hours to come up with my first design, and it was huge, about the size of a soap dish, and held together with a rubber band. And when I went to leave, one kid paid for my materials, and another kid gave me his phone number because he wanted to help me. So I thought I was left so happy that these kids were so great to me. And I'm like, I'm hot in Cleveland. I got a phone number and the equivalent of a free drink.
That's right. They
But
loved you.
yeah, it was a great time because the one kid wanted to go into the medical field and inventing things. He was a lifelong diabetic. The other one, I think he might have been somewhere on the autism spectrum, and we talked
Mm,
a very long time about the Star Wars figurine that he was printing out.
awesome.
And I had to break it to him that we're a Star Trek family. But
Oh.
he forgave me.
He still
But
helped. He didn't retract his phone number.
no, no. But it's just the people you meet along the way are the people that guide you in your journey. You know, I'm sure you've
That is
had
so
people that
true.
helped you too. They've been
Oh,
so kind
absolutely.
and they reach
Absolutely.
out when they don't need to.
Yes.
And you find support in the most unexpected places, whether you're developing a business and bringing something to market, or whether you are going to pulmonary rehabilitation. You find
That
that
is so true.
support, right? Like this product is is did not start out in this form, right?
Hmm.
And our bodies have not started out in the form that we started pulmonary rehabilitation with. You end up with more muscle tone. You end up with lungs that are stronger. The lungs are muscle, right? So it gets stronger
Right.
too. And carrying these portables around, they're heavy. It's like carrying a bowling ball around. I had one lady, an acquaintance, call me because her mother, her 80-year-old mother, who weighed 90 pounds, the oxygen company only dropped off a portable for her. She didn't have a home oxygen concentrator. So the poor lady was trying to carry this around all day.
Oh,
How can you do that
yeah, that's
without,
terrible.
and if she had been in a program like yours, should have had that some support. Someone would have been earlier on would have been like, oh, no, 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 no. Let me tell you, you call up your insurance company, you call up um, your oxygen supply company, and you tell them you need a home
Right.
concentrator,
Absolutely.
and you want this, this, and this to go with the home concentrator. But nobody tells you that,
Right.
right? It's word of mouth. And unless you're in a program like if people don't find you or hear me talking somewhere, they're not going to know.
Right. Right. Absolutely. I am sure that the people listening have a lot of questions. And I wanted to encourage everyone to just type any questions in that you have in that chat box. And we are going to, in a few minutes, just take about 10 minutes to answer any of your questions. Melissa and I could probably sit here and talk forever because I so enjoy hearing everything that you have to say, especially about the development of the O2FRESH, about your experience with lung disease and how you've helped yourself. So I think that we need to definitely plan another time that we can do a live event together.
Great. Yeah.
I would love
Yeah.
that. And I wanted to give some opportunity for those listening to, shoot out any questions to us if they have
Hmm.
questions about lung disease, about pulmonary rehab, about oxygen usage, about developing a new product, or about the O2FRESH. And then I want to encourage everyone to go online and really look at the O2FRESH and what a great product that Melissa has created.
Thank you.
So,
As a professional, I know you see the need for it. Just as a
absolutely.
patient, I see the need for pulmonary rehabilitation, and I can say, hey, this has really helped. I'm sure you've seen patients like drop their nasal cannulas on the
Oh,
floor, pick
yes.
them up, and put them in their nose.
Right. And, one of the things as we were developing our program, if you have sleep apnea and you use a CPAP machine, then we will be adding classes to your pulmonary rehab that
Oh yeah.
includes,
Oh good.
sleep. Well, one of them is how do you keep your equipment clean so that you don't infect yourself, right? Um, and that's, I
Yes.
mean, the O2FRESH is something we're definitely going to put as an opportunity for improving your oxygen usage in
Thank you.
future videos, because we think it's a really great product.
Well, and I use a CPAP or a BiPAP at night too. And I don't leave my nasal cannula exposed overnight.
Yeah.
What if a bug crawls on that? I mean, a fly or
Yeah.
something, and you put it back in your nose. That's gross.
Yeah.
Or it falls
For
on the
sure.
floor and the dog licks it overnight. Like,
Right.
so it's just, it's simple. Just cover it up. They're reusable and sanitizable. Even if you have a hospital or a nursing home, it's like durable medical equipment. You can. I kind of overshot the mark a little bit. I'll tell on myself a little bit.
Yeah.
The material that this is made of is a class 4 material. You can actually implant it in your body.
Oh, wow.
But I thought I'm responsible, and I use it. I use it 20
Yes.
times a day, right? And it is literally always on my nasal cannula right there, so I never have to go looking for it. And I know that it is suspended in there, but what if it touched on here and then you put it in your nose? It has to be safe, So
Right.
I overshot the mark a little bit on the materials, but it's a really good material.
Fantastic.
It's the Cadillac. You're getting the Cadillac.
Right.
Just like you're getting a Cadillac of home pulmonary rehabilitation, and you're getting a Cadillac of the O2FRESH nasal cannula cover.
Absolutely. Well, awesome. I'm going to check in with Dennis. He's behind our camera. And do you have any no questions right now? We explained it so well.
Yes, we did. Yes, we did. You
That's
were
awesome.
telling me last night that when you sign up for your program, your program actually asks you your diagnoses and then tailors the exercises and the information. Can you tell us about that?
Yeah, absolutely. I would love to. So when a person becomes a member of the Exhale Lung Rehab program, what happens is the very first thing is we do an initial assessment. And we ask you to take a strength test, which is literally just taking a chair. We instruct you, and you do it with us, but you sit down and stand up and tell us how many times you can do that in 30 seconds. It gives us a lot of information about balance and strength and endurance. And that simple test tells a lot. And then you have about 10 other questions that are quality of life, that are disease progression, that are what you're diagnosed with. And we have a lot of different things. And then that allows us to tailor your program based on you. So your strength, your yoga, your endurance classes, your breathing exercises will all be tailored based on that diagnosis and the strength assessment, which is one component that was very difficult to learn how to do, because generally we do those assessments in person. So in the clinic, we'll have you in front of us, right? And we'll do those things with you. But we were able to actually create AI technology and algorithms that were capable of placing you in the right courses at the right time and be able to work and learn with you, so that it will change as your strength changes. Or if the classes are a little bit too hard, then it rolls it back so that we make sure to keep you safe. So these are designed specifically for people with lung disease. And it's not just a general exercise course, right? So that is, we worked really hard and created, this technology didn't exist before we started it. So we had to build it from the ground up. And I'm not an IT person. So that was really eye-opening. I've learned a ton. I have an amazing IT group of people around me that we have lots and lots of, you were talking before about prototypes, but lots of versions, right? We're on version 6 right now, and we are developing more right now. We'll have an upgrade that rolls out in a couple of weeks. And then we have more stuff
Good.
going on, like 4 months ahead. We have each month more and more things that we'll be doing. So you're spot
Right.
on. It's really a journey. And I don't think it will ever get to the point where we think, oh, it's done, right?
Right.
We'll keep
Right.
improving and keep improving. But yeah, it's really great that it is tailored to you. And we were able to get it to a spot where we believe that we are as close to in-person as you can get. And you get access to clinicians, and we check on you, and we watch your progress, and yeah, very exciting about it.
Yeah. You know what's really sad is I'm on these Facebook groups for people with COPD or oxygen, and there's so many people reaching out going, I woke up in the middle of the night and my oxygen was down to 65 and I kind of feel dizzy and I have chest pains. Do you think I should go to the hospital? Yes, yes,
Right?
get off Facebook, go to the hospital. But, they're seeking some human warmth, some
Right.
companionship, a person to talk to.
Yes.
And that's what you provide. And you have that whole comprehensive, like you have the food, you've got the text, you've got the newsletter, you've got the daily videos, and you add more and more on. You probably have blog content I haven't seen.
Yes. We just added a new blog recipe actually for curried
For the chutney.
applesauce that you can put, yeah, the chutney. So it is really delicious. I hadn't tasted it, but made it and then tasted it. It was great.
Oh, good. I'll have to try that. I make homemade applesauce in the crock pot.
Oh,
You just,
yum.
it's that stuff in the jar is like, but
Yeah.
it's so easy to make homemade. You just peel them and throw them in the crock pot with a little water for an hour, and then you put the smallest amount of sugar in, and you just mash them up with a fork, and you get this great applesauce, and you can freeze it.
My grandmother used to make apple butter, and
I've
she
had apple
taught
butter.
all of us how to make apple butter, and she has a fantastic recipe. But yeah, in the years since she has been gone, we have still made her recipe, and it's delicious.
Yeah, yeah, and I hope that the people that you and I help can continue to pass those traditions along, because really the most important thing is you want to stay in your home and stay healthy for as long as possible.
That's right.
I have only used antibiotics 3 times in 6 years.
Oh,
That's
wow.
incredible.
That
Yeah,
is
I know, right?
incredible.
Yes. And I
You're
think
beating
it's
the socks
because,
off of me.
well, I wear a mask everywhere.
Yeah.
And even before COVID, I was very careful. I always used my own pen. And like I said, because I have bronchiectasis, I'm very prone to infections. And I do take regular antibiotics. Like I take a daily antibiotic because I have bronchiectasis. But on top of that, I've only had to take antibiotics or had something like a pneumonia or a horrible increase in mucus 3 times, which is
That's
incredible.
fantastic. Yeah, that's really fantastic.
And
Awesome.
one of them was my husband, who never gets sick, brought pneumonia home.
Oh,
And
I'm sure
there's
he
something
felt
that
terrible.
he did, and we were careful, of course, but when something gets in your house, it's really hard.
Yeah.
And you talk about some infection prevention and cleaning in your videos too.
Yes, I do.
And
Absolutely.
that's really hard for people who use oxygen
Yes.
to clean.
I think it's
Yeah.
hard. That infection control aspect is hard for anyone. And in the hospitals, on the clinical side, I'll talk about that a minute, but we struggle in hospitals, and you think of a lot of people think of hospitals as the cleanest place ever, right? But
No, I've read the studies.
constant, yes, infections are there, bugs and bacteria and all kinds of things. So, do hospitals have to clean excessively? Yes. But they aren't the cleanest place in the world. In fact, they're probably the worst place to go
Right.
to try to prevent infection.
Yeah.
But yeah, constant cleaning and a lot of things that you don't even think about.
Right. It's far easier to keep the nasal cannula plugs clean than it is to keep everything in my house clean.
Yeah, for
you know,
sure.
or a hospital
Absolutely.
room. You know,
Right.
in early in my research for my product, I researched about, you know, there is the bedding can at a hospital, you can still become, it gets colonized. You
Mm-hmm.
can't, they can't disinfect it, and they can't, you
Right.
know, and it can even be in like a nurse's uniform, and they go room from room, and they can take it from patient to patient.
That's right.
So you have to be really careful, and that's why you need to start out, if you can, as strong as possible. And pulmonary rehabilitation goes with the infection prevention,
Yeah,
because
for
you
sure.
if you start up here and you get knocked down a little bit, that's a lot better than being down here and getting knocked down a little
Right.
bit.
Right.
As we shared
Absolutely.
last night when we were talking, I said I've been dealing with a thyroid issue for a year now, and I saw the next level or two down, and I'm like, whoa, yeah, this is hard.
Yeah,
I
for
am going to
sure.
have to think about a transplant at that point. But
Mm,
fortunately, the treat with the thyroid is being treated, and my pulmonary issues resolved with that. So I'm back to baseline.
good.
But you know, you get a pneumonia, you get a cold, COVID, and you're pushed back down. If you have a support system like Join Exhale, you can get people to help you get back in that groove. And you can, you know, with the exercise and pulmonary rehabilitation, it's just like being on a diet. You know, you have to forgive yourself for, you know, having that ice cream or something, or having that day
Mm-hmm.
off without exercise. So it can't be an all or nothing proposition. But because
Right.
your program is so easy to follow, it's always there.
Absolutely. And if you have a bad day, everyone has a bad day. And
Right.
so
Or a bad
you
week.
can take, right, you can take a few days, and then we're here. You get to log back on, and you pick up right where you left off, and we're still here, right?
Right. Right. Yeah.
Yeah, that's fantastic. Well, I think we're coming up right on the end of our program, and I want to make sure, okay, no questions. See, everyone loved it. So make sure you
Yay.
go on and check out the O2FRESH, especially if you know someone yourself or someone else around you uses oxygen. It's a fantastic product. We're really excited, Melissa, to have you on. Thank you so much
Thank you for having me.
yeah, I just appreciate you and I admire you. I think you're amazing to
Thank
create this
you.
product. So thank you so much for joining us, and we will definitely do this again.
Well, thank you so much for everything you do for the patients in the community. Your passion just shines right through. And to celebrate you, there'll be a joinexhale.com coupon on my website for 5% off. And that's on Heartful Medical.
Yay! Well, thank you so much. We really appreciate it. Everybody log on and get your O2 cannula cover today, and we'll see you next time.
And log on and get your pulmonary rehabilitation.
That's right.
Thanks.